I think there are many things as a female surgeon that I cannot talk here. That's part of my journey. And the most important thing is that the struggles I faced yesterday are the struggles that I'm facing still today. And that might be tomorrow as well. Situations will change, might be. People, faces, characters will change. But the most important thing is that whether I am moving forward from there or not.
The following is a conversation with Miss Abeerah Pervez. She is a Specialty Registrar in General Surgery working at the University Hospitals of North Midlands in Stoke. Abeerah did her surgical training in Pakistan, where she was a consultant general surgeon under the combined military hospitals. Surgical training is known to be one of the most challenging career paths. Also, the ratio for male to female consultant surgeons in the UK is approximately 8:1. I hope to use Abeerah's extensive clinical experience in Pakistan and the UK to explore the positives and challenges of surgical training. To support the channel, please like and subscribe and check out our sponsors in the description. And now, dear friends, this is us getting a second opinion from Miss Abeerah Pervez. Hello, Abeerah. It's very nice to have you today. Thank you for coming.
Thank you very much for actually calling me in.
I'm excited for this. So, there are serious things that we've got planned to talk about, but I want to ask some funny, quick fire-ish questions.
Okay.
All right. So, the last time Pakistan won the World Cup was in 1992.
And Imran Khan.
Imran Khan, of
My
course.
first crush.
There you go. Do you feel in your lifetime you will see Pakistan win the World Cup again?
I have lost interest in cricket. We have lost so many matches.
I know.
That I have lost interest. So what I do now is that when Pakistan wins the match, then I see that
The highlights after.
the highlights later on.
Right,
So
okay.
I don't follow the cricket that often,
Fine.
and I don't care now.
But do you think we'll win the World Cup in your
I hope
lifetime?
so.
You hope
I
so?
don't know.
Fine. Okay, then. If we went out to Eastern Pakistan, where would you think is the best place to go?
Lahore, anywhere.
All right.
Lahore. I'm a Lahori. I'm a foodie.
Fine. Where in Lahore would we
So
go?
Lahore, actually, if you go to even Kent,
Mm-hmm.
there are food places everywhere. Then you go to Anarkali, Faluda shops everywhere. Then you everywhere. And I think in Lahore you enter anywhere and you're going to find good food places.
Street food as well as restaurant food?
Street food as well as restaurant food.
Right. Okay, then. Even though I'm, Pakistani ethnicity, but I was born, I've only been in the UK.
Yeah.
Can you explain the difference between UK halal food and Pakistan halal food?
So I think when I was in Pakistan, I
Yeah.
never actually thought about the halal food,
Fine, okay.
isn't it? What are you eating is halal.
Yeah, exactly. You just walk anywhere.
Yes.
Fine.
And so when I came to UK in 2018,
Yeah.
that was the first time that I started looking at things, whether it's halal or not. Because
Right.
see, even if you buy a chocolate and if it's from, animal, the source is animal.
Like gelatin
Protein.
and other certain products.
Yes, or even
Right.
if it's beef, something related. If it's not halal, you can't eat it. So looking at all these things on the boxes was the first time in UK, and I've actually tried once. Have eaten gelatin. So because I was
Yeah.
not aware of it.
Right.
So difference I don't know,
Fair.
but that's
What about the difference if you went to a UK halal restaurant, Pakistan restaurant? Quality of food, is it better or the same or?
So I'm going to give you an example for this.
Go on.
When I came to UK and I went for my GMC registration in Manchester.
Okay.
So I asked the lady who was doing my final things that where should I go to eat food, and she said, "Oh, Akbar."
Okay.
Okay.
Yeah.
So I went to Akbar, and I have recently came from Pakistan. So I was like, okay, the food would be good. And I didn't find the food so interesting. But now I find it really nice.
Fine.
So
Fair
I
enough.
think, obviously, the food back home is much better.
Mhm.
And because I think there's so much emphasis on the food back home that we like good food.
Fair enough.
There's no concept of cold food. And here, if you go to a restaurant, the only thing I ask now is the chicken halal?
Yeah, you have to ask that. Fair
Yeah.
enough then. Okay, okay. Where is your favorite place to visit in Pakistan?
Anywhere northern areas. Pakistan is really beautiful actually. It's
Yeah.
it has 4 seasons. At the same time, when in Hunza the trees would be bursting because of the cold weather. If you go to Sibi, it would be very hot.
Right.
In Lahore, it would be mediocre. In Karachi, you'd be like drenching with the moisture in the weather.
Right.
So Pakistan is blessed with a good weather.
Oh, right.
So we tend to enjoy a lot of good weather. Summers are really bad.
Right. Okay. So I went to Sheffield Medical School, and I went to the Peak District, is close to me, and I take my Amiji to the Peak Districts, my mum, and each time she goes, they're like,
What's
it's not as good as Pakistan.
Yes,
like
and that's
Pakistan's
true.
bigger mantras and stuff, and
That's very
Yeah.
true.
fine.
The things we find or they find fascinating here are very normal in Pakistan.
Right.
We have such a good heritage, especially the historical heritage.
Right. Right. What's your fondest memory of home?
So I'm not a very social person. I think I'm more of a family person.
Mm.
For me, staying at home, enjoying with my family, is the fondest memory, and I think I miss that here a lot because I talk a lot, and there's no one to listen here now. When I go home,
Yeah.
I just talk to myself or just do the video call and
Yeah.
I'm talking. But back home, so I miss the family time back home. That's
Fine.
the fondest memory.
Yeah. Okay. All right. We'll go into some serious things now. So you've worked in the Pakistan healthcare system. You went to medical school there. You've trained there. Became a consultant. Could you just describe how is healthcare delivered in Pakistan? Whether that's private or public, what's delivered in the community, what's delivered in hospitals. Could you give that overview of how healthcare works?
So, should I add the med school in that as well, or just the healthcare system?
You can add med school in there, yeah.
So,
We are going to talk about training as well
fine.
after.
So, I think
yeah.
we will leave it to the next question then.
Okay.
So the healthcare system in Pakistan is divided into the private medical system that is very strong there, and then a government setup that is free for people, and then there's an army setup that is mainly for everyone, but it's free for the army people who are the army families and army
Right.
background. So I have worked in all of them.
Okay. Right.
My so healthcare system as compared to UK, I would say that it has a very efficient delivery to the people
Okay.
in terms of the waiting time. Like if you want to get a review from an orthopedic surgeon, you can go to the hospital, whether it's government hospital, whether it's an army hospital. I'm not talking about the private hospital.
Okay.
And you go there and you get an appointment like within a week. And it's not that the work burden is not there. There are not many patients. But I think how the system works is really efficient.
Right. Okay. Then.
I think what we call GP, the GP is not a separate thing in Pakistan, but in that hospital there's a GP sort of person who is the primary referral, and he is the first person to assess you, and then he's going to refer you in the same hospital to respective subspeciality. That is whether orthopedics, medics. Similarly, when we are on call, the the trainee medicine, the trainee orthopedic, the what we call as TNO, and all the other specialities is in the big ED. So we are in a big ED. Surgery is a part of that.
Yeah.
And
Emergency,
yes,
A&E, yeah.
and if they want to refer a patient to us that is under their care, they were just going to come, discuss with us. We are going to see the patient, and the patient might stay under their care, but we are just going to treat our part. Similarly, if I want to get an ECG reviewed, it would be like I will go to the next room where a trainee medicine is sitting. Can you review this ECG?
Do you not read an ECG, Abeerah?
So it's called as two surgeons reading
Yeah,
an
yeah.
ECG is a double-blind study.
Yes.
So, I think I'm okay
Yes,
with
yes,
ECG,
yes. Yeah.
but just to get a review,
Of course,
it was
of course.
it's really easy.
Yeah.
So I think I find it difficult in UK about these NHS, these things to do a referral, to get the thing sorted immediately by another department, and to actually involve the other subspecialty is slightly difficult, and that delays the patient care
Mm.
and the hospital stay, length of stay, and the management and the outcome.
Right.
So that's one thing. Obviously, it has its drawbacks as well. And I would say that the private system is very strong there. And government hospitals might not be having as good care in terms of hospital stay as the private system.
Okay. All right.
But I've found the doctors are equally efficient for both.
Right. Okay. So it seems like, and also before this conversation, I spoke to a few of my family about Pakistan healthcare system. So yeah, one thing I want to pick up is you said everyone goes straight to the hospital to ED, and then you go to the various specialties. The reason we have a GP model in the UK is it offloads work from hospital, and hospital care is more expensive than community care. Do you see that more as an advantage, that you can just go straight to the hospital and then you can see a general surgeon to a cardiologist quicker? But then would you maybe seeing a cardiologist for something that's possibly a general doctor could have seen? I mean, you have recognized that there are pros and cons to it, but do you see that works fine in Pakistan? Or
So the person who's a referral, the GP sort of person in that hospital,
yeah,
will assess the patient first. And if that patient does not need a referral to cardiologist, he's going to do the basic investigations there and then, like ECG, like blood tests. And if does not require, he's just going to reassure the patient and discharge.
oh right, okay then.
So I find it efficient because you don't have to get the appointment 6 weeks for an ultrasound.
Yes.
So you might get it within 2 days. And ultrasound is available 24/7. That's the basic investigation that's available all the time.
Mm.
Because we are not having shortage of manpower back home like in NHS.
Yeah.
NHS is having shortage of manpower. So every system or every investigation that is dependent, that requires manpower, is actually time limiting. For example, it would ultrasound, we have available only up till like 2-3,
Yes, exactly. Yeah.
but that's 24/7 available. A
Yeah.
radiology registrar is always available in the hospital to do an ultrasound in every
Right.
hospital.
Right, okay. And it happens quicker. Right, okay. Can we talk about the private element then? The private hospitals, can they deliver tertiary services? So in the UK, I don't think there's many hospitals that deliver tertiary services, and the private element is not as advanced because our state hospitals are very established. So then in Pakistan, why are private hospitals very established? Do you think that relationship between private and public actually works well? I feel in the UK, when we think of private healthcare, it has this stigma of it's bad, and money's taken away. Does it work well in Pakistan?
I think it works well in Pakistan because you cannot deny that that the culture there, people like to have a bit of lavish sort of, protocol sort of thing, even they go to hospitals.
Yeah.
So if you are from an elite class and you go to a hospital, I think it's in their mind that, oh, why would I go to a government hospital?
Oh, really? That's
Yeah.
what it is.
Yes.
Okay.
So they would go to a private hospital. They will be entertained in a VIP way,
Yeah.
and they will be given the private rooms
Mm.
that are like 5-star sort of a treatment, and then they are able to pay the amount, and it's really expensive. Even the one night stay is really expensive.
Does government commission some services to the private hospitals, or actually do private hospitals only treat patients who maybe have insurance with them or willing to pay that fee?
Willing to pay that fee.
Willing to pay that fee. Okay.
Willing to pay that fee.
Right. Interesting.
Because you pay half of the amount immediately when you enter the hospital.
Yeah. Would you say the government hospitals, the public hospitals, they're able to meet the demands of the healthcare needs of Pakistan and Pakistani people? Or do you think they're not, and maybe private hospitals are taking up that space when maybe they, some sort of combined model needs to be created to serve all the health needs? Do you think that problem could be occurring?
I think because, see, in Pakistan, the young generation is more inclined to become professionals.
Yeah.
So, doctors and engineers, IT specialists, they're not into other modes of other professional things.
Yeah.
So, that's why I think government setups have loads of doctors, but we don't, whether we have that many hospitals, no.
Right.
So we have hospitals like Shaukat Khanum. That actually Shaukat Khanum is one hospital in, I think it's the only hospital in the world who gives free treatment to cancer patients.
Is that Imran Khan's
Imran
hospital?
Khan's.
Yeah.
Imran Khan's
Yes.
hospital.
Right.
And it's a world-class hospital. If you go and work there, it's the standard is really high,
Oh, right.
and the patient treatment is up to the mark.
Okay.
It's doctors all over the world come there, work there, provide their services, and so the Shaukat Khanum is a sort of a mixed hospital where you pay. They have certain rules where they provide free services as well as they charge patients as well.
Right.
Then we come to the government hospitals. So government hospitals are very crowded. We definitely need more hospitals. But I think there are more doctors than the hospitals.
Okay then.
Yes.
Okay.
So I think in Pakistan we have more doctors than the hospitals, although there are many hospitals. But still, because there are so many doctors being produced every year,
Yeah. Yeah.
so many professionals.
But there aren't spaces.
So that's why there's more efflux to the rest of the world, to the rest of the countries, UK,
Yeah.
Australia, Canada.
Right. How would you say public health interventions are in Pakistan? We see public health, I guess, in terms of reducing the burden on hospitals, delivering community care, the softer sides of medicine, the social aspects, whether that's healthy eating and stuff. GP does somewhat fall into that as well, because GPs are expanding. They have various clinics and they're developing specialist nurses. Is there a public health system in Pakistan? How effective is it? Or is it actually, let's say, the model that you described that is very hospital based?
No, so I think we have to admit that the community services,
Yeah.
we lag far behind.
Right.
In Pakistan. I think there is no concept of the community services yet in Pakistan. Might be Aga Khan or Shaukat Khanum are delivering those services, but rest of the government hospitals and private hospitals, no.
Yeah.
I think it's more linked to the family system as well. That when a patient comes in, there are like 5 relatives who'll come in as there to take care of the patient, and you actually have to tell them to go home.
Yeah.
It's difficult to send the relatives back home from the hospital when they have come with the patient, and it's really difficult for us. So when we discharge the patient, for example, of diabetic foot, the 5 children will be standing there to take care of the wound, and they'll be like, oh, don't worry, we will manage. So I think that's why the we have never actually thought of developing the community services. Might be, but I think definitely we need that.
More.
There are a lot of work required. We actually don't have any community services, I would say.
Yeah. Okay. All right. What would you say are the major health problems in Pakistan? So in the UK, I could describe that we have an
Obesity.
aging population, obesity.
Yeah.
What would you say in Pakistan? It would
I
be?
think hypertension, diabetes are the main, and tuberculosis. So here is Crohn's, but back home it's tuberculosis. That's really common.
Right.
And hypertension is really common. Diabetes is really common. Obesity is not that common, but obviously it is, I think, now increasing. But I think these are the primary problems in Pakistan at the moment.
Right. Okay. So from looking at it, one problem I hear is there's an insufficient funding of the healthcare system. Of course, there will always be. I think I've learned that now. But I guess that's why I was asking about the private and public hospitals, because let's say if there's a gap in the market, then private hospitals fill it. But let's say in the UK, our government is strong enough or established that we have enough government services to deliver, most of the needs required. I was looking into it. So in terms of GDP, so that's the percentage of how much government spending goes to certain things. So in Pakistan, they spend 1.4% of their budget
Yes.
on health, whereas in the UK, we spend 9.3%. So then that takes away the argument of, fair enough, the UK has more money, but they're actually putting more of whatever they have into health.
Yes.
I guess, why do you think there's an insufficient funding of health in Pakistan? Is it actually because maybe they are dependent on these private services to deliver the healthcare, therefore they don't need to? I don't know if I'm leading on that, but
I
want to
think
hear your insights.
I would say priorities of the government.
Okay.
So the doctors are working in much less pay
Yeah.
and than anywhere in the world.
Really? Okay.
Yes, and I think in many of the house officers are working without pay. There's no concept of working without pay in UK or any other country, but in Pakistan, many doctors work without pay just out of interest.
Really?
Yes, and
Why is that a thing?
because I think there is a now it's becoming more common, and there are unions who are asking that the pay there should be a pay raise. But when I was working, so I have worked in when I was a house officer, I have worked in a very less amount of pay that I cannot even tell anyone that how much I used to get. So I think it's just the concept that was there, and we never questioned it.
Okay.
And as we got, because we thought, oh, okay, that's just how our healthcare system is.
Was it because the prestige of being a doctor is good enough that it was bad or ill to talk about pay when you would think doctors get paid a good amount, or?
Maybe,
Okay.
maybe, or I think because I have and I never actually needed money to survive at that time, so I never questioned it. Many of my colleagues, most of my colleagues, didn't need that money. We were from well-off families, so we never questioned it whether we're getting the money or not. But because I was not working in a government setup at that time, so I cannot say on behalf of them, because if you are a man and you have a family, you have to raise a kid, you have to pay the bills,
Yeah.
you have to pay the your kids fees and everything. It's really and to pay the rent, it's really difficult. So I think that's how the unions, different unions, were formed,
Okay.
and that's how the pay raise and the pay doctors pay became a big question.
Because it got to a point that doctors actually couldn't afford these things, or
Yes,
somewhat.
or somehow
feeling a
the
bit of a
people
pinch.
started questioning the system.
Okay.
So even now, I think it's not very well paid.
Hmm.
But now I understand, what my understanding is, that everyone is getting paid, and there is no concept now.
Right. That's very interesting that people were just working for free. As in, this is not the same, but we work extra hours, whether you have to stay another hour just to complete a task, or maybe there's an unwell patient, to then doing the extra CV things to progressing your training. But you were saying people used to just work
Whole year of FY1
and they just wouldn't
and
get
don't
paid.
get a pay and never felt bad about it.
Is it just pay you get in Pakistan as a doctor, or do you get certain services, whether that's parking or housing or other things, or no, is it just pay?
So I will just say, I'm not going to classify it as an army doctor or as a private or a
Yeah.
government doctor. No,
Yeah.
you don't get housing services or anything. No,
Okay,
no,
right.
no.
Okay.
You are
Interesting.
responsible for everything yourself. And now I look back and I like, really?
Why did you do that? To be
Really?
honest?
Wrong life choices.
We were talking about at public hospitals that healthcare is offered for everyone. So I was looking into this. The World Health Organization, they introduced this, I think in 2013, 2014, universal health coverage.
Yes.
They wanted all countries to have a staple to deliver health services for everyone: preventative, treatment, rehab, palliative care. Pakistan introduced in 2015 the health card, or the
That was under Imran Khan.
was it Imran Khan? So I read it.
It was Imran Khan.
So Imran Khan, did he introduce it nationally? But it was trialed in KPK.
So
Yeah.
KPK was Imran Khan's government.
Okay.
So
okay.
2015 Imran Khan
Yeah.
was it was KPK was under Imran Khan.
Okay.
So it was introduced only in KPK.
Oh,
And when
that's
he
why.
became
Okay.
the
Yeah.
Prime Minister of Pakistan,
Yeah.
then he introduced it all around nationwide.
Okay.
And actually it was for the poor people.
Yes.
And there was quite a ransom amount that
Okay.
you can get in that, and actually your all health services would be covered in that, and people were really happy about it. So I think that was a great move, and I'm not sure whether the new government is following that,
Yeah.
but I think he made a lot of changes in the healthcare system that were really good. Few of them we could see the difference at that time. Unfortunately, most of the things we were not able to see the difference because of the government change and the system change, and obviously they were not implemented then.
So it was introducing. Okay, that makes sense now.
Yes, it was introduced in
Fine.
KPK under Imran Khan
Okay,
in
because
2015.
Nawaz Sharif was the prime minister at the time.
Yes.
But yes, KPK, yes.
KPK
was
was
Imran
under
Khan's
Imran Khan.
parties. Yeah. Right, okay. And then he saw this initiative and
Yes.
thought, I'll introduce it here.
Yes.
And then when he became prime minister,
Yes.
okay.
Because I know all these things because I was the primary fundraiser for Shaukat Khanum since my school.
All right.
So I have been quite involved in the fundraising for Shaukat Khanum.
All right. So before, let's say, 2015, what was not offered to every Pakistani? What was it actually? You can receive anything, or was there gaps in what could be offered in your healthcare system?
So the government setup was free.
So government was free. Okay.
Government setup is free.
Yeah.
Government setup is free for everyone.
Okay.
But obviously then it comes with a lot of compromises, quality compromises. The availability of beds, the people are even in the corridors because there's so much crowded.
Mm.
And then you have to admit that obviously the staff the hospital would be having is not equal to the number of patients or the crowded hospitals we have. So I think government setup in terms of doctors is good, but the quality we are providing is not as good as compared to the private system.
Right. And then
Government setup is free.
government setup is free. Okay. But then when the Sahalat program was introduced,
Yeah.
or the health card system was introduced, then what had actually changed from that?
So you receive a card,
Yeah.
and that card has a certain amount of money for a
Yes.
certain duration.
Okay.
So if you want to get a surgery and you just go to the hospital, you show that card, and all that money will be covered in that card.
Oh, right. Okay. Would you say it does cover most things, or let's say, if someone has a chronic condition like high blood pressure and they would require long-term medication?
Yes, it will be covered in that
You
amount.
think it would? Okay,
would
so
be
there is
covered
a
in-
decent amount covered
Yes,
in it.
decent amount will be covered in that amount during that duration, and
Right,
mostly,
okay.
yeah. For what I know, it was a quite ransom amount.
Right, okay. Or if someone, let's say, has advanced cancer and they have like one cancer resection and then ongoing radio and chemotherapy, could that be covered? Or
So
because that'd be quite expensive
there are
treatments.
centers that actually are affiliated with the government hospitals
Yeah.
that provide the free cancer chemo and radio.
Oh, right.
But obviously, there are limitations. For example, medications the hospital won't be able to provide
Yeah.
certain medications that are very
Yeah.
expensive or something. So that would be covered in that health card. Yes.
Right. Okay.
So anything that the person requires
Yeah.
during that duration
Yeah.
would be covered in that health card.
Right. Would you say this program has actually had a benefit? I ask because, of course, it is a good principle to have universal healthcare. And it was recognized that health actually impacts on many other things in someone's life: social, family, working. But Pakistan is a developing country. Do you think Pakistan has the ability to take on, certain masses, take on that financial responsibility while still developing as a nation?
See, Hassan, I think we have to understand our strong points as Pakistani.
Okay.
And our strong point is the professional young generation, and that is doctors and engineers.
Mm.
Okay. And if we are going to not utilize them, then someone else will.
Yeah.
Okay.
Yeah.
And if I'm sitting here in UK, that means my system might not have been utilizing me properly
Mm.
back home.
Mm.
That does not mean that UK is utilizing me properly. I'm not saying
No, of course.
But I'm just saying that I do need to go out and seek opportunities elsewhere if my own country is providing me that much opportunities back home.
Right, okay.
That's first. Secondly, that's unfortunate that every year there are so many doctors being produced. Obviously, who are really good, who are really hardworking, who are actually working without pay. That is not a concept anywhere in the world. And then they come elsewhere in the world and they make name for themselves.
Mm.
And we are your biggest industry, and you are not utilizing your biggest industry. So that's why you are a developing country, because you are not playing on your strong points.
Right, okay.
Businesses are not strong point.
Mm.
Creating
professionals
yes.
is a strong point
Yes.
of Pakistan. And so I was going to talk about this later, but I'll bring it up now. Have you heard of the term brain drain?
Brain drain.
Brain drain.
No, I've not heard of it.
So
So
brain drain in principle is not just in Pakistan but other developing countries, where the top 10% or so highly educated people end up moving to other countries,
Yes.
mostly Western countries like UK, Canada,
Yes.
America. So Imran Khan, in one of his launch campaign speeches, had said, "Most of the people in our country get disillusioned and take off. There's a massive brain drain amongst the educated youth, but I want to tell them to stay and fight. It has the potential to be a rich country, yet this fails to get exploited properly because of the government." Could you talk about your experience of maybe brain drain, or the educated youth or competent individuals who are leaving Pakistan, coming to UK and other countries?
So, I think I might not be the right person to be quoted as the brain drain,
Okay.
because I think I made a choice because of the circumstances that were there, and I might have been fascinated to actually get new experiences when I made that decision. But when I see, as a neutral person or as a part of the doctor club in Pakistan, I would say that obviously when a topper comes out, now you have cleared your exam, you're a consultant. If you are part of a consultant fraternity where they're going to support you to settle down, you will get a good hospital job to actually show your skills and to actually build your skills as a consultant now. Because obviously, initially, you need support. But I think one person might get that. The rest of them then go to the private setup and start experimenting.
Okay.
And that's the problem. Because if I go, I'm a new consultant. I start seeing patients as a consultant in private setup, and I write all my degrees. Unfortunately, the patients are not, all of them are not well educated. And I might be the only doctor who's immediately available to them, and might be the cheapest option as in the private setup. And they're going to come, and I might be actually building my skills on human bodies.
I see that.
And that's not fair. So there, I think that's the gap there.
Right, okay.
So there's no check and balance for that.
Yeah.
So I think that's what Imran Khan wanted, that gap in between should not be there. And so you start from zero. After you have done the MBBS, you start from zero again. You have to go to different hospitals, apply for different exams,
Make more connections.
And then you enter training system.
Yes.
You go through that training system, and then you again clear your exam after the training, and you become a surgeon, or you become a consultant.
Yeah.
And then you have to start again from zero. It's a different race now. So, and if you are a threat to that consultant fraternity, it might be that the lobby won't allow you to work anywhere, and they might block you in private setup as well.
And you explain that problem with the private setup. Sorry, when I asked this question, I wasn't saying necessarily you. I was just talking about brain drain in itself.
I know, but I just said that I'm
I
not
understand.
the right person.
No, of course, but that story makes sense. That there may not be enough places, or you may, the softer side, disrupting the system in the, let's say, the government hospital that you really want to work at. But then in the private sector, you feel it's still not a great environment because you're utilizing human bodies, as you would describe, just for your own development or learning.
No, that's not
which
right.
is not right.
I won't like it from
That's
my
an
mother.
interesting perspective.
I won't like it from myself.
Yeah.
I won't like it from my family. Why would I do it on other people?
Right. Okay. Before brain drain, do you actually see that as a problem that there are Pakistanis leaving their home country?
Yes.
Because and why is that? Why is that a thing? Like, we worked in open GI surgery. I would say there's strangely not many white doctors there.
Yes.
Everyone is international or
Yes.
Asian.
Yes.
And there may be some non-Asian doctors, and you got a few white doctors. Why is that? Why are maybe in health and other? Why are Pakistanis leaving Pakistan?
I think there are multiple factors now.
Yeah.
When I left, the trend was not that much to leave Pakistan when I left. And it was
2015?
2018.
2018.
I
Okay.
left Pakistan in 2018. So the trend was not. So people were quite happy back home at that time. The
Yeah.
doctors would say. Few were going, but it's just out of interest.
Yeah.
But now it's just, I think it's epidemic now there. And why is that so? I think, first of all, the crisis, the political crisis in Pakistan, number one. Number two, the economy, deteriorating economy because of the governmental policies.
Yeah.
That was a very established economy at one point under Imran Khan. And third, I think the lack of opportunities, the lack of recognition of the people sitting in the authoritative positions to recognize that it's very important to implement the rules and the changes immediately. Otherwise, you won't be able to keep the brains back home.
Mm.
And then I think everyone wants to earn money.
Of course. Yeah.
Everyone wants to have better quality of life. So considering how the situation is deteriorating, obviously people are looking for better opportunities.
And that's why they move away.
Definitely.
Right. Okay. At Imran Khan, or like, what do you think is the best way to then keep Pakistanis, keep the top 10% actually staying in the country? Is it actually just addressing those things?
I think
Because surely you need those brains to stay to help develop the
Yes,
country.
Yes,
Yeah.
definitely you need the brains to stay, because we need those brains at the right positions for the next generation.
Mm.
Otherwise, you'll get the brains at wrong brains at the right positions to actually deal with the population who is actually posh of the country,
Mm.
cream of the country.
Yeah.
It's your cream. So I think the policies need to change at the right time. I think that's an emergency at in Pakistan, just to make the right policies to actually let the doctors know that you will be you'll flourish here. You'll
Mm.
flourish here, and that would come from the top notch.
Mm.
Government is the first thing.
Mm. Okay. Could you tell us about how you moved to the UK? You have touched on it, but your thoughts, the process of moving here, how did it work for you?
So I never had any any idea that I will move to UK.
Yeah.
I finished my training,
Yeah.
and then I gave my exam. I was one of the position hold highest scorers. So I went to meet the chairman in the College of Physicians and Surgeons, Lahore.
Okay.
And when I was meeting him, I said, "Oh, there's they're going to be an interview next month, and why don't you give the interview? We are sending the doctors to UK for fellowships." So I was like, I don't know. I said, what? Okay, I said, what are the requirements? He said, IELTS. You do the IELTS, and then their 5 bench will come, and they'll take the interview. So I said, the IELTS date has already passed. So I was already late. So he said, okay, I'll arrange. So CPSP arranged the IELTS test for me as an urgent basis.
Okay. Okay.
So that meeting was on Thursday, I submitted the fees on Friday and my test was on Saturday.
Okay then. All right.
So I cleared the speaking test, and then it was the written test, and I was somehow selected for the interview.
Right.
And I went to the interview. There was bench of 5, Mike Hellisay, big name in Birmingham. So he was one of the bench members who was taking the interview. 2 consultants were from Pakistan, and 3 of them were from UK. And he was asking most of the surgical questions. There was a director of medicine as well from Birmingham. I can't remember the name. He was asking more of the social questions, whether I would be able to survive or not.
Yeah.
And all these things. And I gave the interview, as a chill, well thing. And I was more interested in working in Shaukat Khanum.
Okay then.
Yeah.
Shaukat Khanum is the cancer hospital.
It's the cancer hospital. I was always interested in working there, and my primary interest is cancer surgery.
Yeah.
So I was interested in working as a fellow in surgical oncology.
Okay.
And I've already applied there. So I applied there, and I was thinking only of Shaukat Khanum.
As a surgical oncologist,
fellow.
As a fellow.
So I wanted to do a fellowship in surgical oncology in Shaukat Khanum, and then I wanted to continue there.
Okay.
And then I got the information that I've got selected, and I have to move by September here, and I'm the first batch who's selected as the fellows. And so I said no.
Okay then.
And then I received a call from I met Mike Hellisay as well, and I received a call from Mr. Kayani, who was leading that program, and he asked me why I'm not interested, and I actually shared my reservations, and primary reservation was that I won't be given any hands-on. That's what of the feedback I got from the people working here in NHS, that okay, I thought that I would be a 3rd grade citizen there, and I was wasting my time, so I shouldn't be. And he just reassured me that you should come, just try it. And after like 5-7 discussions, I said okay, fine. And that was a great move for me, because I have moved to Lahore just for Shaukat Khanum, to work in Shaukat Khanum, and so my mother moved there because of me. They bought a house there, and when we have settled for like 1 year or something, I just decided, okay, I'm going to UK.
Oh, right. Okay. So your family moved and committed, and
yes, because my father was in Islamabad at that time, posted.
Yeah. Okay.
I'm from an army background.
Okay.
So, but my family was really supportive. They said it's your decision. So I moved to UK in 2018, March 2018.
Right. Okay then. Okay. And you worked in Birmingham Hospital, Queen Elizabeth Hospital?
So I worked in
For-
Heartlands in QE.
yeah.
So we were, I worked there, and then Fremley later on,
Yeah.
and
Right.
then in Stoke.
And now you're at Stoke, which is the upper GI department, I believe, is known to be like a cancer resection
Yes.
specialty
Yeah,
in
it's a really
the
good
nation.
department.
Yeah.
Yes.
Is that the standard process for how someone would move from Pakistan to the UK as a doctor? How hard is it to move to the UK?
So it's really hard. You have,
Okay.
I think it was meant to be for me.
Really?
Yes, it was destined, because I have not given any exam
No.
for UK.
Yeah.
I've not done MRCS. I've not done PLAB.
Mm.
So I came without any exam, just based on an interview.
How long were you a surgeon for? A consultant.
So I recently gave my exam. So I was recently became a consultant
Right. Okay. Fair enough.
after finishing my training.
Yeah.
So and I was actually planning to do the fellowship
Right.
at that time.
Right.
So
But it's competitive moving to the UK.
yes, it was difficult. It's difficult coming to UK as a doctor, because you have to give a MRCS or a PLAB, and then you have to find the jobs. For me, everything was just planned by someone else, and
But
I
you
just
went through
came
this
in.
competitive fellowship type role, interview type role. Right. Okay then. But so how does it work then for someone to move to the UK? Move from Pakistan to the UK. So do they have to sit exams before they come? Do they have to find a job before they come?
Yes.
And interview?
Yes.
That sounds.
Yeah. So everywhere.
But then why? I'm so shocked. I guess there are so many Pakistanis and Indians and many Asian doctors in the UK, but a lot of people are willing to do all those things to come here. Is it that when it sounds like a lot of work, like I'm applying for core surgical training soonish, and I'm thinking that's a lot of work. Someone moving.
I think because doctors in Pakistan are very equipped with the exams all the time.
Fair enough.
So for them, coming to UK is just another exam, and you have to do the tick boxes. So it's just a tick box for them, and then to apply for the jobs, whether as an FI1 or an SHO. So I think that's the concept back home, that you just have to do the exam because you have to move, whether it's moving to Australia even. So I think many of my juniors during med school were doing their homework, which exams they have to give. So many of them have already then done their USMLE 1, step 1, while they are doing their med school.
Like they're already semi-preparing or got a backup plan.
Yes.
And which Western country that they tend to go to.
Yes,
Right.
definitely. Most of them.
Really?
Most of them. And during med school, they have finalized where to go. So you're going to ask any third year, fourth year student what they're going to tell you, oh, I've done PLAB 1 or I'm giving USMLE step 1. And so everyone is already know, or they have already planned what they're going to do.
Have they planned that if I had to go to a second country, this is where I'm going, or they are quite a lot actually planning? I am going.
I'm going, so
Right.
that's why I've planned it.
Okay.
Not if.
Would you think maybe as the Pakistan government need to think about retaining their doctors if it's very much known that some are actually preparing years to go to another country?
Yes.
For example, in the UK, if you wanted to be an army doctor, they can pay for all your tuition fees, but then they say you have to work for the army for 5 or 10
But
years.
that's in Pakistan as well.
Oh, really?
Yes.
Okay.
So if you're going to be an army doctor, because I studied in Army Medical College.
Right.
So if you want to be an army doctor,
Yeah.
you're going to live there free of cost. You're not going to pay any fees, but you have to work for a certain amount of years.
Right. Okay.
You sign a bond, you sign a
Right.
contract,
Okay.
and what we call as military cadets.
But I guess what I'm asking is, for non-army doctors, I do want to talk about your army doctors as well. But for non-army doctors, Pakistan has spent 5-6 years training someone.
Yes.
You would like to keep them for some amount of time to get that return on investment. I don't know if they think about it in the UK as well, but
There's no infrastructure to retain the doctors now at the moment.
as you were saying?
So you have to build the infrastructure. You have to build the policies that will actually allow the doctors, or to actually attract the doctors, the new generation doctors, to stay there.
Right, and the structures meaning more hospitals, more posts.
More opportunities, a good pay, a good lifestyle, a good quality of life, more training opportunities in good hospitals. You
All
have to
of
do
that.
that.
Interesting. So then how do you feel about moving to the UK? Have you enjoyed it, or
So
how do you feel now that you weren't planning for it? You've been here for
5 years.
5 years,
Yeah.
How's it been?
So it's been different.
Have I made that experience worse when we've arrived on the ward round together? Like, I've got a SNEN now. Extra work for me.
I think it's different because I didn't know what I'm coming to. I didn't have any expectations, but obviously I had certain baseline things that I was hoping for. You cannot deny that it's a different system. You have to contain your expectations initially because you are understanding the system. it never bothered me that I finished my training and oh, I'm starting at a reg level and actually I'm being treated as a very junior doctor when I started. Um, you cannot deny that you don't know anyone.
Yeah.
You are not friends with anyone. Unfortunately, you belong to a culture where you don't drink
Yeah.
and you don't go out with your consultants or your colleagues to a bar in the evening and get drunk. I'm not saying that this is actually impacting my training, but this develops the social comfort zone to work with.
Mm.
And so you're not friends with anyone when you come in. You don't know anyone. You have a different culture. You have a different language.
Mm.
You have a different expression that is loud,
Yes.
straightforward,
Yes.
not using the right words.
Yeah.
And you don't know these expressions.
Yeah.
And you don't understand that many of your expressions that are being straightforward back home and taken as very polite might be scary for people.
Mm. Mm. Right.
So that's one thing of the other thing is that they have not seen you work.
Yeah.
And you don't know a lot of things that, for example, their community part, you never had any idea back home. Then there are multiple referrals and there's a hospital guidelines for everything.
Yeah. Yes.
You don't know anything. So 1 year you just learn. And after that, then the journey starts, I think, after 1 year.
After that adjustment. Right. Okay. And now you've started the journey. Would you say the things that you were talking about, those softer things, the social side, let's say you speak English, but you can't interact with an English person, let's say. Would you say that's improved? You've maybe grown to understand it? Are you liking it maybe? As in, are you happy? Are you settled with English culture? Even with interacting with Pakistanis and Indian doctors who've also migrated here, but they also have to somewhat integrate in English culture. How's your...
I think it's on both sides. We accepted, so both sides have accepted each other.
Yeah.
Because you cannot deny, as you were saying, that there are many Asian doctors now. So how we think they somehow have started to understand as well. It's not only us who are making an effort. It's only the system. Obviously, the other side, the system is making an effort as well.
Mm-hmm.
But having said so, the system needs doctors. We cannot deny that as well.
Yeah.
And we need training. So I think it's both sides who are making an effort, number one. Number two, obviously over the years, I have understood how to work. And English culture might not be a problem or might have not been a problem, but to address certain things, how to address them, I have understood that. That previously I didn't. Because back home, we deal in a very different way.
Yeah.
We don't have an email system where we write 50 emails for one issue.
Yeah.
We just go, we talk to each other, and that's sorted.
Yeah.
So I, as a person, am straightforward as well. Second year, belong to a culture. So if I have a problem with you, the next day I'll see you, I'll talk to you. And we'll talk for 5 minutes and it's sorted. Yeah?
But email is, it's not just communication, it's documentation.
Yeah. So
Yeah.
here, I don't know there's an issue.
Yeah. Yeah.
But there's an email.
Yeah.
So thankfully, I have not been the part of that where
Yeah.
I've received an email about me. But I'm just saying that I have learned the
You've heard
email
about
culture here
Mm.
and how to address the things in a more formal way
Yeah.
rather than an informal.
Okay. Can I move on to women in surgery?
Oh yeah, touchy topic.
Touchy topic, of course. So I was trying to draw up some statistics. So this is in 2022. These numbers, I think, I did expect it to be a bit lower. But so for female registrars in training, I've got various specialties, but I'll just touch on a few. So in plastic surgery, 42.2% of registrars are female. General surgery is 39.8. We've got neurosurgery 24.7, trauma and orthopedic 21.6. So I think we can say there are less women in surgery, and that is known. And Royal College of Surgeons, England and Edinburgh, they are talking about it. Let's just start with an open question. Why do you think there are less women in surgery compared to other medical GPs? And yeah, why do you think that is the case?
I think there are few factors. Number one, the most important is work-life balance for females. Number two, I think surgical specialty, although gynae is considered as part of surgical specialty, but I would keep it aside.
Separate, yeah.
Yes, separate. Has always been considered as a boys' club specialty. And if you go back even when the female surgeon who was the first trauma surgeon who used the name of showed herself as a man to operate. Over the years, it has changed, but the statistics say that, and even the more recent, that the problems females face while working as surgeons is far more as compared to their male colleagues.
Okay.
And whether it's so there was a recent paper, I think, from American College I was reading, that even female surgeons have complained more of the musculoskeletal pain because the ergonomics were not adjusted for them as well as were adjusted for their male colleagues.
Meaning, like in theatre, when you have to have a higher table because you do it for the lead
Or you're
surgeon.
assisting even.
Yeah, but you're assisting, let's say, a male consultant who is taller than you, but you have to adjust to that. Okay, that's interesting. I didn't know. Okay, sorry. Yes.
That's a very recent paper from American College.
Okay.
So that's one. That's the milder thing that I've just quoted.
Mhm.
So female, I think, because of all the problems that have been discussed in various journals that females experience as surgeons, that's why it's a bit less here.
It's like that. Okay. So I'd like to touch on a few of those things. Let's talk about the male dominance. Do you think, let's say now, there are less women entering surgery because it's so male dominated and it, is off-putting? Is it because there's a male culture when you work in those environments? Or is it actually there are less female role models or people to speak to that you could feel related?
I would say all of them.
Okay.
So I don't have any female role model in my mind as OG surgeon.
Right.
Okay. That's number one. Number two, I think you cannot deny that I have, and that's the statistics proven as well, that as a female surgeon, I have to work harder as compared to my male colleagues to get an equal level of attention.
Okay.
I've not used the word opportunity.
Mm.
I've used the word equal level of attention to get that opportunity.
Okay.
Okay. The third part is that it's not reaching the seniors. That's the problem. I think it's dealing with your colleagues to actually have that same level of opportunity or discussion or respect, or I don't know how to say it. It's difficult as well. It takes time. You have to remind repeatedly.
Mm. Okay. Are you not getting as much attention because of stereotypes that are placed on women, let's say in surgery, that a woman can't become a consultant, a woman can't become a surgeon? Why is there a lack of attention?
I'm not going to say that that's getting an attention because of it's being labeled as.
Yeah.
I think it starts from that when you start working in a team, you want a very fair sort of an environment where you want equal opportunities, you want equal level of respect. And I'm not talking about the outside the hospital, how you deal. You can have friends with someone, but when you're professionally working, you have to have a very fair sort of an environment to work with. I think so I will talk about Royal Stoke. Let's talk about Royal Stoke Hospital.
Yeah.
I think the seniors have been supportive.
Yeah.
But to get my training needs sorted, I had to verbalize it multiple times. That this is my training need, this is my training need, this is my
more than a male colleague, you would feel.
More than a male colleague.
Okay.
Then the problem is that there's a concept of gel well in the department.
Okay.
And I have not been able to understand this concept up till now. Because when you start raising your concerns anywhere, I'm not going to talk about Royal Stoke, anywhere, and that's what one of the papers said as well. The first thing comes is, oh, that person is not gelling well. So you have to, I think that's a very wrong concept, that you have to accept a lot of things just to gel well.
These social soft things, when actually you're just training to be a surgeon and develop practical skills, but gelling is...
I think surgery is not only a practical skills. Softer skills are required, especially if you are becoming a consultant, because your end part is to become a consultant.
Yes.
It is to deal with difficult people, with your difficult colleagues. It is to manage a difficult trainee. It is to
hopefully not me, that you weren't talking about me too much.
It is to manage, to be in a leadership role, where you have to deal people from different backgrounds and address with fairness, and you require a certain amount of firmness, and you have to be assertive.
True.
So these softer skills are equally important, and all these situations arise actually to, I think, build in you that qualities. But what I'm talking about is how other people want you to see, how other people want you to be.
Okay.
And that's the pressure as a female surgeon.
By fitting into that mold that may be
Definitely.
very different to who you are. Okay. Do you think the ideal world is actually having a 50% men, 50% women? Or do you actually think, even in an ideal world with various policies, it actually won't achieve that target? And what I mean is, let's say if we had the right policies, do you think and let's say addressing any cultural or soft things or any policy changes, do you actually feel that in an ideal world that we could actually get 50% of registrars and consultants being female in all specialties? Is
No.
that achievable? You don't think so?
No.
Okay, and why?
Say, I think the pressure in surgery is so much that many of the trainees actually, and there are articles about it, that the female trainees try not to get pregnant during their training years. And even when they are applying for consultancy, although that's a forbidden question to ask according to the rules, but there's a bit of concern that if that consultant is pregnant and applying for a job. And I have one of my colleague who experienced that.
Oh, right.
So I don't see it happening equal. Historically, and even now, many of the surgical subspecialties like OG, HPB, and more orthopedics are more considered as boys' club specialties.
Yes.
And to enter as a female, to ask for equal opportunities, to be assertive, to get your way for equal opportunities, and then to stand your ground and gel well in the department as well, and then become a consultant, I think is a great achievement.
So you think those softer things, even through policy changes, it won't quite reach 50%?
I was not added in by my colleagues in the research group.
Oh dear. Yes.
Yeah.
They just
thought that there's a WhatsApp group and no one actually bothered to add me in that group. That does not mean that is a hindrance for my research. No. I'm doing it.
You are.
I'm doing it. But it just gives you the fact, oh, okay, am I not the team member? And I think that's very important to feel as a team member. To feel that you're equally respected as your peers. And you have a say as equal as your peers. And I think although that might be a very small thing when I see it from a higher hierarchy, but for me these little things matter.
Yes.
These little things tell you that, okay, that my boss is concerned that why Abeerah or why this registrar has not been added, because we are doing this for our department.
Yeah.
And I might be the person who takes these things as important, but I think the learning from these things for me is that when I am at that level, none of my trainees should feel that way.
That separation or feeling of isolation in a way. Okay. Do you feel it is possible to be a female surgeon who wants to have a family and kids?
So I think it's more a problem on my side rather than it's from the surgical side.
Fair enough.
So I never thought that I'm unmarried. I don't have a partner. I never had a partner. I never had a boyfriend, and it's primarily because of my culture as well, that we don't believe in boyfriends and
dating
partners,
necessarily.
dating,
Yeah.
but we strongly believe in the school of marriage, the fundamental of marriage.
Yeah.
But I think it's more a problem from my side.
Fair enough then.
That
Fair enough.
I never thought that surgery is going to stop me from getting married or having kids.
You never thought that.
If I want to marry you now, I will. If I decide it now, I will do it now.
Fine. Okay.
And
That's never been a barrier.
It's never been. I would never consider surgery a barrier. It's just that maybe I haven't made that decision.
Okay. Have you seen it as a barrier for other female colleagues in surgery, or we can even talk it broadly, just generally doctors?
Yes.
You have seen it as a barrier.
Yes.
Okay.
Yes. Many of my surgical colleagues, specifically, yes.
Right.
And if you see, many of the surgical trainees get pregnant very late.
Right.
Even my male colleagues
No, that
have
is
kids
true. To
really
be honest,
late as
there
well.
are male doctors end up doing it later, of course.
No, but I think, jokes apart, male, I don't think so. That's very common for the males. But that might be few odd examples. But it's very common for the female surgeons. Very common.
Does surgical training need to be made more flexible? Could you maybe think of any policy changes that are actually achievable to...
Flexible in terms of what?
Let's say surgical training is known to be very intense. There's, we talk about is multifaceted skills required of surgeon, not just the practical side, but the leadership side. There's on-call duties for surgeons, right the way from F1, F2 to all the way consultants. It is known that we do additional things in our spare time, exams, audits, publications. But I'm saying more flexible. Could that be a way to encourage more females into surgery?
Not only surgical, but every specialty has become more glamorized.
Yeah. Okay.
There's so many tick boxes.
Yeah.
You have to do that. Sometimes I feel like they want ready. They should order some robot for that, because they want everything in one person.
Yeah, they do.
And that's not right. The problem is that if I'm good skilled and I don't have good communication skills, I'm handicapped as a surgeon. If I don't have good research publications, many research publications, I'm handicapped as a surgeon. If I don't go to I don't present at different forums, I won't be known as a good surgeon. So I think it's a pressure at the level of the surgical trainee. When you become a consultant, you can decide how you want to go about it. But as a surgical trainee, every day, as the years are passing, I do one tick box and the other is ready to do, is already added up. So I think it should be less glamorized. It should be more realistic. You need to decide that whether you want a stress-free surgeons who are good in managing their patients.
Yeah.
Obviously, we all need a bit of research work. But if we want everything in one person, that's just a race that everyone is running. And I think it will become really difficult, or to some extent toxic as well.
Right. Okay. I've drawn your expertise on various things, but I have also brought here because I've been impressed with you. And this is my favorite question to ask any doctor, which is, can you tell me your story about why you wanted to become a doctor? Where did that grow from?
So there's no one in my family who's a doctor. I think when I was young, my mother always saw me as a doctor.
Okay.
That was not a pressure. She saw me and she used to think I really want her to be a doctor. somehow,
How many siblings have you got?
2 elder brothers.
2 older brothers. What did they do?
So one is an engineer and one has done an MBA and he has his own business. So they have a very lavish lifestyle.
Fine.
And
But they wanted you to be a doctor.
yeah, I don't know why. So she used to discuss that I really see her as a doctor. And when I used to go to, because I belong to an army background.
Yeah.
My father is an army officer. So I used to go to CMH and I used to see doctors wearing very smart saris and looking really nice and taking care of patients and very smartly dressed in very nice hospital and, talking to patients very nicely and giving a very good care, very competent. What I would say as alpha females.
Yeah.
So I think I always wanted to be that alpha female.
Okay.
Yeah. And then as I grew grew older and I became in school, and then I found no, I really wanted to be a doctor. And I think when I was applying for that, I had a conversation with my parents, and my father gave me an open choice, whatever I want to do. And I chose medical specialty. And my mom, I remember, was really happy. And then, yeah. So I don't regret that. I don't think so. I was good for any other specialty. And then I joined Army Medical College. I wore that sari for 5 years.
Yes. And did you feel proud wearing it?
Oh, yes, definitely. I did my drills in that.
Yeah.
We used to have an army training with that, along with that med school. So we were trained to handle that pressure. And I think that was the key point that I survived all alone in UK.
Right. Because that grit that you develop as an army doctor.
Yes. During that 5 years,
Yeah.
we were trained in that cold weather 5 o'clock drill. And evenings, we used to go for multiple exercises and multiple other things. So I think during those, and very, very strict, disciplined life.
Yeah.
And my father is very disciplined as well.
Yeah.
Has been very disciplined. We always had that timetable as a yeah. Oh gosh. So I think that just so I think I cannot do anything else.
Was your father strict but also loving? Did they find that?
My
right
brothers
balance?
don't think that he was loving with them,
All right.
with them, but I think he has never said anything to me ever, ever. So I remember that when he used to come to pick us up, none of my brothers used to like to sit on the front seat, but
Yeah.
I used to sit. I used to tell him all the stories of the school and everything. Yeah, he was a brigadier at that time, and then I enjoyed. My father never said it. I never had any sort of restriction in whatever I want to do. I had a blessed life. I'm very blessed in every possible way.
What got your interest in surgery or even upper GI surgery?
So I worked more in thoracic surgery and upper GI. So thoracic surgeons do upper GI surgery back home.
Oh, really? Okay.
Esophagectomies, gastrectomies, because back home you have to do general surgical training for 5 years, and then you have to do 3 years of other subspecialty training, either thoracic, either you want to become any other plastic or whatever. So you have to be a general surgeon before.
Is that not the same in the UK?
No,
Oh, right.
no, you don't have to be a general surgeon and then give exam
Okay.
and then become choose the subspecialty.
You go straight to upper GI or lower GI or breast or...
No, you have your training years of
Okay.
general surgery,
Yeah.
but you don't give exam.
Oh, right.
And then you choose the subspecialty and you go there.
Ah, right. Okay.
But back home, you have to be a general surgeon first, and then you give exam for your subspecialty. So I worked more in that, and then I came to UK in surgical oncology. After 6 months, when I spoke to Mike Hallisey, he advised me that I need to choose a subspecialty to survive in UK in NHS because we don't have surgical oncology here.
Right.
And because I had more experience of upper GI and I have been the part of esophageectomies and gastrectomies more. And I never liked colorectal.
Okay.
So plastic is very slow for me.
Okay.
I'm very impatient person. And
I feel general surgeons are the busiest.
yeah.
One of the busiest
And
surgeons.
I think you have more achievement as well, isn't it?
Well, I'm interested in plastics, and I like
you
that intensity, I guess, or
you're a
dealing with very
patient
unwell
person.
patients.
Unfortunately, I'm not.
I feel like general surgeons deal with a mass or more patients.
Yes.
Yeah, fine. Okay. I've got some funny upper GI questions. So for an elective appendectomy, removal of the appendix, is that for a lower GI surgeon to do or an upper GI surgeon to do?
It's for a general surgeon to do.
It's for a general surgeon to do. Because I feel when I did my on-calls in upper GI, it would fall on the upper GI consultant, but I was just doing my MRCS revision, and the appendix is attached to the cecum, which is, so I think it's a general
So
surgeon.
apparently, if you say so, the appendix is attached to the cecum and it's part of the colorectal domain. But I won't say that. Never
Fine.
on this forum.
Fair enough. Fair
No.
enough then.
So it's part of general surgical.
General surgery.
Everyone should know how to remove an appendix
Fine.
as a general surgeon.
Okay. An upper GI endoscopy, is that for an upper GI surgeon to do or gastroenterologist to do?
So both.
Both. Okay.
Both.
All right.
Upper GI endoscopy as an upper GI surgeon is very important
Mm-hmm.
because if you are operating
Yeah.
and you need to see that how a tumor is inside and at what level it is inside, you have to do an endoscopy yourself. I cannot call a gastroenterologist while I'm operating. I will just get an endoscope, I'll insert it and
Sure.
understand and then plan my resection.
Right.
So both.
Okay. Could you tell me a joke that is between upper GI surgeons and lower GI surgeons?
I'm not aware of. There are many, but I'm not aware of.
Fair enough then. Fair enough. I'm more saying because I think I remember listening to a talk and they said, lower GI surgeons, they have to deal with stools, whereas upper GI surgeons deal with vomit, and which one's best to deal with at the end of the day. I've heard that.
So, yeah, we were talking about this sort of
Yeah.
joke the other day in theatre as well. But I think I will leave that.
Fair enough then. Fair enough then. My final question is, there'll be people listening today. What words would you say to young aspiring medical students, secondary school students, young girls who have a passion for education, passion for, maybe going for something that's a little bit more ambitious? What would you like to say to them?
Focus on your goals. Don't listen to people. Be assertive. Stand your ground. And whatever is meant for you, no one can take it from you. Just stay there. That's it. Whether you're standing alone, whether there is no one supporting you, if you're right, stand up for yourself. If you're wrong, say sorry. But believe in yourself. There should not be any person who can tell you cannot do this. If there is someone who tells you that you cannot do this, make sure you do that thing tomorrow, the next day.
It's been an inspiration to listen to you. I would
Thank you.
invite you if I didn't find you fascinating and interesting.
Thank you very
I
much.
enjoyed working with you on Upper GI. I look forward to those days when we did ward rounds because I could feel the intensity or the busyness of your day, but you still found the time to be kind to me, to explain things to me. And even now, I'm hearing your story. And even though I don't know your struggle, but I feel like I could understand your struggle. And it makes me appreciate you even more. So thank you for taking the time to speak to me today. I'm sure there are other things I would love to talk about, and it'd be great to have you again. So thank you for your time.
Thank you very much. I have learned a lot here today. It was great having a chat with you, and I actually vented out, I think.
Exactly.
You give me the opportunity to talk. I love talking.
An enjoyable session. Thank you very much, Abeerah, for
Thank
today.
you. Thank you very much.
I would like to finish with a quote from the Nobel Peace Prize winner Malala Yousafzai. It is so hard to get things done in this world. You try and too often it doesn't work. But you have to continue and you never give up. Thank you for listening to the Second Opinion podcast. Please like and subscribe if you enjoyed listening and check out our other channels. See you next time.